So what is cognitive reframing? An underlying assumption of cognitive therapy is that an objective event, A, causes subsequent beliefs and thoughts, B, which lead to emotional and behavioral consequences, C. It is further believed that our responses in C will affect how we perceive and react to similar situations in the future. Cognitive reframing works at step B to correct biases in information processing and modify the core beliefs that are supporting our faulty conclusions. It attempts to reduce negative symptoms by modifying maladaptive thoughts believed to maintain many psychological disorders. Cognitive reframing is a culturally responsive technique because it works within a client's cultural framework and considers their cultural identities when making practical observations and suggestions about possible changes. Cognitive reframing provides exercises where the client is taught to stand back and question their negative automatic thoughts. The first step involves identifying and describing the thought, and identifying the situation where the thought came about. The second step involves evaluating the evidence surrounding these thoughts, including gathering evidence that both supports and contradicts the thought. The client is then taught to weigh the evidence and use it to draw conclusions about the accuracy of these thoughts. Essentially, cognitive reframing works to teach the client to see their situation differently. It doesn't deny the reality of the situation, but rather teaches people to approach it with a different perspective. Depending on the situation and the client, the ultimate goal of cognitive reframing may be to create an entirely new, more appropriate thought, or the goal may be to adjust a thought to a more balanced and productive response. Specific situations that are causing distress can be evaluated in counseling sessions. However, cognitive reframing requires the client to practice these skills outside of the therapeutic environment, including doing homework in their everyday lives. One homework often associated with cognitive reframing is known as a thought record. A thought record involves keeping track of what is going through your mind at the moment of the distressing event so that these thoughts can be evaluated, challenged, and modified. The first step is identifying the situation and the automatic thoughts and emotions that arose in that situation. The next step involves identifying alternative responses and reactions. The final step involves detailing the outcome of the situation. A thought record is particularly helpful because it provides the client with the opportunity to visually see their thought processes written out in a structured format. The goal is not to challenge the client's thinking directly, but rather to help them question and consider the accuracy of their thoughts based on evidence from their own lives.